This miserable baby elephant was noticed deep in the wild, suffering from an unspeakable pain from a wire stuck in his trunk. The trunk is very important for the survival of the elephant, as it is useful for the elephants for several purposes, such as smelling, trumpeting, breathing, and drinking, etc. At the time when the wildlife rescue team arrived into the jungle to treat the elephant calf, he was wandering with the herd near a lake. The elephant was in a critical stage and he required immediate medical attention. They thoroughly cleaned the wound and stitched together the elephant's trunk. But after regaining the consciousness after sedation, the elephant at once is dangerous, since the elephants are well known to be aggressive in difficult situations. The situation is more critical as the baby elephant is with its herd, and elephants are more defensive when they are in a group. First, they have to calm down and sedate the elephant with anesthetic, which is administered using a tranquilizer gun. They administered mild doses of anesthetic so that the elephant is sedated in a standing position. The anesthetic made the elephant immobilized and unconscious. The veterinary surgeon came into action and hurried to cut and remove the wire, relieving the trunk from long-term suffering. This is a very risky operation, since the situation could be dangerous if the elephant regains its consciousness before finishing the operation. They noticed that trunk has been injured due to the stuck wire. They cleaned the injured place thoroughly with hydrogen peroxide to disinfect. Then packed the place with povidone ointment. Anti-inflammatory and long-acting antibiotic have been injected to aid a speedy recovery. They stitched the gaping hole in the trunk using strings and needle. This poor elephant was trapped with a wire snared around its trunk, which was set by the hunters for the purpose of hunting wild boars and deers. These type of snares are strands of wire usually strung up between two tree trunks. They are often used to bush meat hunting of wild boars. Unfortunately, elephants also have been injured, some fatally by wire traps intended for other animals. The snares often inadvertently cripple or kill other animals. The encircling wires restrict the blood supply in deep cuts and are prone to infections that can be fatal. An elephant's trunk, also known as proboscis, can be used to breathe, bathe, transport water to its mouth, and grasp objects for eating. Due to the defect in the trunk, the elephant may find it difficult to grab foods and intake water. That may cause malnutrition and weakening the animal. Performing surgery-related procedures in jungles with primitive facilities is not an easy task, but the dedication and commitment of veterinary team made the effort a success. The man-made injury caused her severe pain, but after a 3-hour operation by vets, her trunk was thankfully reconstructed. The sutures in the trunk will integrate the gaping hole caused due the wire snare and allow the regrowth of tissues. The elephant is still in the unconscious situation due to the effect of anesthetic. The vet surgeon administered revival drugs to the poor animal to bring back the normal situation. It looks quite recovered from the pain that he endured. Soon the elephant walked away to rejoin with its herd. The team members involved in helping this innocent baby were overjoyed. Each and everyone present felt that they had achieved something truly special that day, helping to provide relief from unspeakable suffering of a poor baby elephant.